I'm Kathryn Kitten, and I'm an advanced practice provider for Bryan Heart. When I first graduated nursing school, I started on a progressive care unit, and that's when I was introduced to the world of cardiology. I found I had a knack for it. The arrhythmias came to me pretty easily in terms of identifying them, and then I became fascinated by all of the things we can do in cardiology, everything we can actually fix to make people feel better. An advanced practice provider is a nurse who's gone on for additional training to assess, diagnose, and treat common conditions. My biggest passion is sitting down and talking with patients and explaining to them what happened with their cardiac condition. I really enjoy teaching the patient what is going on so that they know this is why we did the studies, this is why we recommend the therapy, this is what we can do if this doesn't work. We can come up with a plan that's hopefully going to make you feel better and reassured. Common cardiac concerns that patients come to me with are they're having recurrent chest discomfort, or maybe an increase in shortness of breath, they're feeling a bit more fatigued, maybe their blood pressure is not under good control. Sometimes it can be pretty severe symptoms that would maybe warrant a hospital evaluation, and we can facilitate that. But then also talk with the cardiologist, their primary cardiologist, and that collaborative piece helps us not only to provide the best care for the patient, but also helps us learn as a provider so we know what to do for the next time. What's interesting about cardiology is that in the last 25 years, there have been significant strides in practice recommendations, and that's really improved how people feel. When we find a treatment that works for somebody and they come back to us a few months down the road and go, you know what, I'm feeling great. Everything we talked about at last visit, I've been incorporating some of those things and I'm feeling better. That is really satisfying because then we know we have made a difference, and that's important.